I have 4 minutes. I have no idea why I think that I can get this all done on time, but welcome back to TikTok Med School. Let's get started. I recently had a case in the emergency room that reminded me of a more interesting case from residency. So as you may already know, I trained at a very large level 1 trauma center in New York City that also within that hospital had a very large psychiatric emergency department. And one day while working in the emergency room, I received a phone call from another resident working in the psychiatric emergency room asking me to evaluate a patient. I'm already late. We're going to have to do this and walk. All right, well, I failed at doing that. I completely forgot that I started this TikTok before this shift. Here we are 12 hours later. Let's get back to the patient. Oh, I just saw a possum. Oh my God, that is the ugliest thing. Oh my God, that was about to come home in my backpack. I'm so tired. The psychiatric resident was taking care of a patient that was suffering from auditory hallucinations. They were hearing things that didn't exist. And the patient was also labeled as having visual hallucinations or seeing things that weren't there, but the psychiatry resident was concerned that that was not the case. You go to evaluate the patient and you come across a male in his late 40s who's been in the emergency room for approximately 4 or 5 hours. He has a past medical history of schizophrenia, which has been associated with prior presentations to the emergency room associated with auditory hallucinations and paranoia, but never visual changes. He denies any substance use. His blood work has completed while he's been in the emergency room, and his drug screen has also been completed, all of which are normal and negative. He's complaining that he's seeing floating black specks in his vision that sometimes block out his visual fields, and he's also having difficulty seeing in his peripherals. He denies any pain, and on exam, he has no signs of trauma. All right, we got through it. That's all you need to know for the first part of this case. I'd like to know what you would like to do, what tests you would like to order, what treatment would you like to order, if any, and then what are your next steps? All right, we'll talk soon when the sun comes up.